Okay, great. Thank you so much, Dan. Yeah, so what does it take? What does it roughly take? Well, we've been doing compliance plans, as I said, since 2003. We've been training. We have online training and running people through this. And we have two different ways of doing this. You either can do it yourself, or you can hire a company to do it for you. When you do it yourself, we find that it takes roughly about 40 to 50 man hours to do it. This depends on what tools you have. This includes doing a thorough risk assessment, creating privacy and security policies and procedures, provided that you have a template to work with. I wouldn't recommend doing this from scratch, and I would not recommend necessarily hiring somebody to create something like this from scratch. There are some great templates out there I think will give you a structure to work with. Also, this means reviewing compliance plans for your business associates and training, which is really important. And training, again, needs to not only be on the law in general, but also needs to be on your specific practices, policies, and procedures, and you need to make sure you're maintaining those records of training. Dan and I had a really interesting discussion yesterday about what the costs are if you don't go through with this compliance plan and creating this, going through this process. Because when you think about the number of hours and what this can cost you as far as out of pocket to be prepared for this versus what it costs you after the fact, after the horse is out of the barn and you're trying to get it back in. And we did a sort of an exercise yesterday thinking about what it would take if a small practice, say with 600 patients, had a laptop that was stolen. They had no encryption on that laptop, and they're looking to say, okay, we need to contact all 600 patients whose data was on this laptop, what it would take to make sure we remediate that, and we came up with a figure at about $15,000 to $20,000 to fix that problem. That includes getting a lawyer involved, doing those proper notifications, and that doesn't take into account the loss of trust that comes with not having a policy that will protect those patients. There are many patients that have stated that they wouldn't come back to a healthcare provider that has had a breach of this, and you look at that, and you can understand, because a physician's job is not just to treat a patient; it's also a position of trust. It's really something that I think something to think about is your job is to protect that information as well as protect the patient. And so that brings us to the end of our presentation here. I think we're going to open up the floor to some questions here. Before we get started, I just want to bring to everybody's attention that joining us here on this webinar today, we do Total HIPAA here is offering a 10% discount off of all of our products and services. And this is what we do specialize in. Dan, I don't know if you want to throw out a little plug there for your services.
I'm a lawyer. So yeah, I mean we help our clients, big and small, in all of their healthcare needs, and to the extent I think we're a reasonably priced firm for the expertise that we bring, and obviously each situation is different. But we're here, and we've enjoyed working with NueMD and Jason at Total HIPAA on these programs.